Your heart beats about 100,000 times every day and pumps nearly 2,000 gallons of blood through your body. But have you ever wondered how this small organ manages to keep blood moving continuously throughout your entire life? In this video, we will break down the anatomy of the heart, how blood flows through it, and how the heart's electrical system controls every heartbeat. Welcome to Tutor Hamisi, where we explain nursing and anatomy topics in a simple, clear way. If you are a nursing student or studying anatomy and physiology, understanding how the heart works is essential for your studies and clinical practice. Let's start with the basic structure of the heart. The heart is located in the thoracic cavity between the lungs. This space is called the mediastinum. It sits slightly behind the sternum and between the two pleural cavities that contain the lungs. The top part of the heart is called the base, where the major blood vessels connect. The bottom pointed tip is called the apex, which points slightly toward the left side of the body. The heart is protected by a sac called the pericardium. The pericardium contains fluid that helps reduce friction as the heart beats continuously. Without this lubrication, the heart's constant movement could damage surrounding tissues. The heart has 4 chambers that work together to move blood through the body. The 2 upper chambers are called the atria. The right atrium receives blood returning from the body through 2 large veins, the superior and inferior vena cavae. This blood is low in oxygen because the body has already used the oxygen. From the right atrium, blood moves into the right ventricle. The right ventricle then pumps blood to the lungs through the pulmonary artery. In the lungs, the blood picks up oxygen and releases carbon dioxide. The oxygen-rich blood returns to the heart through the pulmonary veins and enters the left atrium. From the left atrium, blood flows into the left ventricle. The left ventricle is the strongest chamber because it must pump blood to the entire body through the aorta. To make sure blood flows in only one direction, the heart contains 4 important valves. The first 2 are called atrioventricular valves. The tricuspid valve is located between the right atrium and the right ventricle. The mitral valve, also called the bicuspid valve, is located between the left atrium and left ventricle. These valves open when the atria contract and close when the ventricles contract. The heart also has 2 semilunar valves. The pulmonary valve controls blood flow from the right ventricle to the pulmonary trunk. The aortic valve controls blood flow from the left ventricle into the aorta. These valves prevent blood from flowing backward when the ventricles relax. The heart has its own electrical system that controls the timing of each heartbeat. This system begins in a structure called the sinoatrial node, or SA node. The SA node is located in the wall of the right atrium and is often called the heart's natural pacemaker. It produces electrical impulses that spread across the atria, causing them to contract. The electrical signal then reaches the atrioventricular node, or AV node. The AV node briefly delays the signal so that the ventricles have time to fill with blood before they contract. After this delay, the signal travels through specialized fibers called bundle branches and Purkinje fibers. These fibers spread the electrical impulse through the ventricles, causing them to contract and pump blood out of the heart. Each heartbeat consists of a repeating sequence called the cardiac cycle. The cardiac cycle has 2 main phases. The first phase is systole. During systole, the heart muscle contracts and pumps blood out of the chambers. The second phase is diastole. During diastole, the heart muscle relaxes and the chambers fill with blood. These 2 phases repeat continuously to maintain circulation throughout the body. A normal heart pumps about 70 milliliters of blood with each beat. This amount is known as the stroke volume. Like all organs, the heart itself needs a supply of oxygen and nutrients. This supply comes from the coronary arteries. These arteries branch from the aorta and deliver oxygen-rich blood to the heart muscle. If these arteries become narrowed or blocked, blood flow to the heart muscle can decrease. This condition is called coronary artery disease. Reduced blood flow can lead to chest pain, known as angina. If a coronary artery becomes completely blocked, the heart muscle may not receive enough oxygen. This can cause myocardial infarction, commonly known as a heart attack. During a heart attack, part of the heart muscle becomes damaged due to a lack of oxygen. Common risk factors include smoking, high blood pressure, high cholesterol, diabetes, and a sedentary lifestyle. Early diagnosis and treatment are critical to prevent serious complications. In summary, the heart is a powerful muscular organ that pumps blood throughout the body using 4 chambers, specialized valves, and an electrical conduction system. Every heartbeat helps deliver oxygen and nutrients that keep the body alive and functioning. Understanding how the heart works is essential for anyone studying nursing or healthcare. If you found this explanation helpful, please like this video and subscribe to Tutor Hamisi for more simple nursing and anatomy lessons. Also, share this video with classmates or anyone studying anatomy and physiology. Thank you for watching, and I'll see you in the next video.